The muscles of the neck. The first muscle is the sternocleidonastoid. In this video, I'd like to talk about the origin, insertion, nerve supply, and action of the sternocleidonastoid. This muscle has two heads. The sternal head coming from the anterior surface of the manubrium sterni, and the clavicular head is coming from the superior surface of the medial third of the clavicle. The insertion, it's inserted into the outer border of the mastoid process of the temporal bone. You can see here, this is the mastoid process. And it also inserts into the lateral half of the superior nuchal line, and this is part of the occiput. So we talked about the origin, which it has two heads, and the insertion, which goes to two parts of the insertion as well, the mastoid process and the superior nuchal line. And the nerve supply is the spinal accessory nerve. And this is actually a cranial nerve. It's not a peripheral nerve. Plus C1 plus C2 give also nerve supply to the sternocleidomastoid. In the action of this muscle, you need to focus on how they are directed and what happens when these fibers shorten. So it has a sort of oblique course from the origin all the way up to the insertion. And this will let us think that the action can be divided into two things. Does it work alone on one side or both sides? Is it unilateral or bilateral? If the action is unilateral and it shortens, it will be able to turn the head to the other side and do a very slight flexion in the neck and can let you look to the other side superiorly. And if it works on both sides, it will be able to flex your neck and it might be able to elevate your chest. To summarize, the sternocleidomastoid is one of the important muscles in the neck. It has two heads. One is the sternal head and two is the clavicular head from the superior surface of the medial third of the clavicle. The insertion is the outer border of the mastoid process of the temporal bone and also the superior nuchal line, the lateral half. Nerve supply is cranial nerve 11, the spinal accessory nerve, plus cervical 1 and cervical 2 rami. The action, if it's unilateral, it will let you look to the other side upward. And if it's bilateral, it can flex the neck or elevate the chest.